Okay, so because we're all about finding hidden culprits today, I've decided to bring Mr. Brachialis into the picture. Okay, another little hidden culprit, does lots of really fancy, funky things, especially one to the thumb. But it also does, because it's a pure flexor, okay, so for Karen, obviously being as a strong woman, there's lots of little activities that she does that's going to be requiring a lot on this brachialis. So it's funny, we were just talking before, and she was saying when she's doing a lot of the flipping of the tyres, and they're not small tyres, they're big truck tyres, I'd imagine. So flipping those, she's starting to get some paresthesia, pins and needles in her finger. So brachialis can certainly be a part of that, because you've got the sensory branch of the radial nerve that spins around there. So it wraps around the back of your tricep, comes through here, and obviously because your brachialis is right here in your bicep, can get entrapped in there. So you might get some sensory feeling or paresthesia in your finger and so forth. From a trigger point of view, it will refer beautifully into your thumb, which is perfect for us therapists. Bit of thumb pain sometimes can be caused by your brachialis, okay? So it's a pure elbow flexor, okay? And it's hidden too, because it's hidden underneath the bicep brachii, okay? So in order to get to this muscle, we sort of need to shift the biceps out of the way, sink down. Now the feedback will be pretty strong because you're pushing down back onto the bone, so the humerus there. So that means you need to be gentle on your pressure. So you need to slowly sink into this muscle, and it's just littered with trigger points. You know, well, obviously it's just like one large trigger point as far as I'm concerned. So anyway, so the way we do that, I'm going to use the arnica this time because it's got a lot more slip. So it's not about the grip here, it's more about just sinking into the muscle. So I've got Karen, she's here, just got her hand on her belly because she's looking forward to seeing what's going to happen here. We're going to come down the side of the bicep and just sink in. We need the elbow flexed, girls and boys. The reason being is because we want this muscle to be as soft and as loose as we can, okay? Because it means that we can then sink down onto the actual brachialis itself, okay? Like so. So I'm going to come down the outside here of the lateral part of the tricep, sink off that, then lateral border of the biceps brachii. I'm going to be using this finger here, this one here, the middle one, the rude one, and we're going to sink down into brachialis. Now you'll sink down, you'll feel right there. You feel that, Karen? Okay, so we're right on that brachialis there. So it's really important that I just press enough, but not too much. If you don't believe me, you're more than welcome to massage it yourself. So you just come in, pick up your bicep, pull it out of the way, and then basically sink straight down onto the bone, and that will put you right on top of that brachialis, okay? And that will let you know straight away how much feedback you can handle, okay? So really good way of testing the waters. So once again, lateral head, come down, push the bicep out of the way, and then we're going to sink down into that brachialis there, okay? Littered with all those trigger points right through there. Feel that there? Now, I can sometimes swap over, bring the thumb over the top of the pointer finger, come down just to get a little bit more purposeful. Okay, so you'll see that through there, okay? And do not be surprised if your clients start to feel a bit of thumb pain. That will be that trigger point referral. Okay, and if it does bring on the paresthesia, then you know you're basically right on that radial nerve sensory branch. Okay. Now, you can try and work it while it's on stretch, but you need to be mindful that your bicep and all the tissue there wants to push you out. Okay, so whilst you're working in there, you might find that you're not necessarily going to be able to get the depth that you want. So that's why I always tend to work it in a flexed elbow, okay? Sinking down there, and then you can just hold, work backwards and forwards, and see how comfortable that is for your clients. Yeah, but it will help them lift better.
So if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.